Hello, my name is Crystal Njoku and I'm a Tuskegee University nursing student, and today I'm going to perform a breast examination. First, you're going to introduce yourself to the patient as I did, and I'm going to ask them for their name and date of birth. Perfect. And then I'm going to start off with a few questions. So some of the questions you want to ask is there any history of breast cancer? Do you know of any family members that have breast cancer? And also let them know that men can also get breast cancer too. So it's important for everyone to get a checkup for breast exams. Then I'm going to inspect shape, size, and symmetry of the breast. A normal breast is round and symmetric, typically. And then I'm going to have the patient stand up. And with this, I want to check for retraction and movement as I tell them, where to place their hands. And retraction and movement basically helps to identify a mass within the breast. So the patient is going to have their hands over their head, and then the patient is going to have hands over their hips, and then the patient will flex their pectoral muscles. And also, while they're doing that, you check for any lesions, any bumps, any fillings, and then you also check the nipple to make sure that there's no tearing or that there's no discharge. And then you're gonna have the patient lay down as well, and then you are going to assess and palpate the nipple. So with this, you want to use 3 fingers, not the tip of your fingers, but kind of like the bed of it. And then you want to go in and do light, medium, deep palpations. So starting off light, and then you go deeper. And then also while the patient is laying down, you then want to palpate the axillary area, the axillary lymph node, which is right where your armpit is. And if the patient is laying down, their armpit is going to be like this. If they're sitting up, you want their arm to be bent. So first, I'm going to find the lateral axillary, and I'm still using 3 fingers, and I'm going in circular motions. And then you want to find the central axillary, which is deep inside the armpit, deep inside. And then you want to find the pectoral axillary, which is a little more above. Well, a lot of them are inside, and then you want to find the subscapular axillary. And that concludes my breast exam.